There's kind of two main types of arthritis. There's osteoarthritis, which is more the musculoskeletal condition that most people talk about, and that's actually a degeneration of the joint. So that cartilage between your upper leg bone and your lower leg bone kind of thins out, and as that thins out, sometimes there's increased bony growth in that space, and that pinches into the space, which can cause that stiffness. There's also rheumatoid arthritis, or RA, and that's more of a systemic inflammatory process, and that involves a little bit more with some certain medications that you might need to go to, and especially at a rheumatologist, versus with OA you're more likely going to see an orthopedist. Osteoarthritis, how does it present itself? People will complain of various different levels of issues. One big one is going up and down stairs, so either going up or down doesn't really matter. They might need to use a handrail a little bit more than normal because they just feel like it's so hard to bring that leg up or to bring the leg down. It's just not moving as smoothly. Getting up in and out of a chair is a big one because it's really hard to move the joint, especially those knees or your hips. Or your back for that matter. And being in a position for a really long period of time, as well as just the act of sitting, but just sitting for a long period of time, there's less fluid movement in the joint and less lubrication. So when you go to get up, because there's less lubrication, it's very stiff. The time of day your stiffness occurs and how long it lasts. So for instance, is your stiffness just pretty much when you get up in the morning and it's stiff for like maybe 10 to 15 minutes before you get moving a little bit better, and then your movement kind of increases it, and that's because of that fluidity that goes into that joint, and as you're moving around better, there's more mobility in the joint. That's more likely like an osteoarthritis type of symptom. Small joints, so if you notice more in your hands or your fingers or your wrist, you notice them there first, and it's usually both sides, and then it progresses to more bigger joints, and it's both sides. That would be more likely like a rheumatoid arthritis because it's systemic, so it's not going to pick one side versus the other like osteoarthritis. It's more global. So how physical therapy can help? How can we do that for you? We can determine the root cause. So even if we see patients who haven't seen a physician, we're highly trained to be able to determine if it's something that we can take care of for you. So the stiffness, is it because of arthritis, do we think? We can do specific tests and measures to determine that in the office without a problem. We would give you individualized exercise program. We would look at you, assess where your issues are at, whether it's range of motion only, range of motion and strength. We incorporate exercises so we can do that for you. The biggest thing is the manual treatment. You can't really do that to yourself at home, so we can assess what kinds of things hands-on that we need to address, whether it's helping with the swelling, which we do some retrograde massage for, modalities such as ice and or heat depending on how you're presenting, joint mobility, so that means we're moving the joint in a specific way to increase a specific motion, and also just soft tissue work on some of the muscles, because sometimes even though the joint's stiff, your muscles around the joint kind of get overworked, and we kind of need to address that as well. We spend a lot of time with you, and we go over the root causes. We describe the anatomy in ways that you can understand. We can help you prevent the problem from getting worse. We can improve that joint stability. We can give you the proper progression of exercises. And the biggest thing is the patient's goal. So whatever you want to return to, whether you're younger and you play sports, or you're older and you just want to be able to walk around your house or walk down the street to get your mail out of the mailbox. We can help you with those things and get you back to doing those things. So if you'd like some more information about joint stiffness, or you think you may have an issue with joint stiffness and it's getting worse, just call the office for more information or click the link below.